Hello. A variety of inhaler devices are available to treat lung conditions. This video will show you how to use your pressurized metered dose inhaler with a large volume spacer device. If you use your inhaler correctly, you'll get more of the medication into your lungs, giving you better control of your breathing problem. But if used incorrectly, you may have poor control of your condition, with the risk of side effects, such as a sore throat or mouth infection. A spacer is an attachment which makes it easier for you to use your pressurized metered dose inhaler, especially if you find it difficult to coordinate pressing the inhaler and breathing at the same time. It also helps to get more medicine into your lungs. There are different makes, shapes and sizes of spacers available, but they all work in the same way. There's a mouthpiece at one end, and at the other end there's a hole for you to attach your inhaler. Some varieties come in two halves, and you need to fit them together before starting, whilst others need to be pulled apart to open. We're going to show you two ways of using your metered dose inhaler with a spacer. You should always sit upright or stand up when using your metered dose inhaler, and hold it in a vertical position like this when you load and use the inhaler. Remove the cap from your inhaler. Hold the inhaler upright and shake it firmly 4 or 5 times. Insert it into the spacer. When you're ready, breathe out gently as far as you comfortably can, but not into the mouthpiece. Place the mouthpiece of the spacer into your mouth and between your teeth, but don't bite down on it. Close your lips around the mouthpiece to form a tight seal. If you're using a spacer with a mask rather than a mouthpiece, place the mask over your mouth so that there's a tight seal around your face. Press the top of the inhaler down and take one slow, deep breath in, whilst keeping your lips sealed around the mouthpiece. Hold your breath, take the spacer out of your mouth, but continue holding your breath for 10 seconds or for as long as is comfortable. Now breathe out slowly. If you find it hard to hold your breath or to take a deep breath, you may want to try this alternative method. After putting the mouthpiece of the spacer into your mouth, press the top of the inhaler down and take 5 normal breaths in and out through your mouth whilst keeping your lips sealed around the mouthpiece. Take the spacer out of your mouth and breathe out slowly. Whichever method you use, you need to breathe soon after pressing the inhaler, otherwise the medication will fall to the bottom of the spacer instead of going into your lungs. If your doctor has told you to take 2 puffs, wait for 30 seconds and then repeat the whole process again, using your preferred method. It won't help if you take several puffs without waiting, and you must always firmly shake the inhaler 4 or 5 times between doses. Once finished, replace the cap on the inhaler to keep dust and moisture out. If your inhaler contains a steroid, brush your teeth or rinse your mouth with water and spit it out after every use to prevent mouth infections. Ask your pharmacist if you're unsure whether your inhaler contains a steroid. It's important that you look after your spacer, and here are some tips. Ensure the spacer is the correct one to fit your inhaler and that it's the right size for you. Wash your spacer regularly, preferably twice a week. Follow the instructions in the leaflet provided with your spacer. Gently pull the 2 halves of the spacer apart. Do not take the valve apart. Wash the 2 halves in warm water, which can contain a mild detergent such as washing up liquid or sterilizing solution. Rinse thoroughly with clean water. Leave it to air dry at room temperature. Don't rub the inside of the spacer, as this may cause static, which can affect the inhaler. Store the spacer in its carton to keep it clean. Your spacer should be replaced at least every year, especially if you use it daily, but some may need to be replaced sooner. If you're unsure about how to use your metered dose inhaler, speak to your GP, practice nurse or pharmacist for assistance.